Welcome and thank you for speaking to us at DentaltownUK, and welcome to the Digital Symposium here in London. So I guess one of the first things I want to do is thank you for the Keyhole article that you did for us.
That was an absolute pleasure, and I was delighted with the way it turned out.
Yeah, it was very good. Now, you're speaking here at the Symposium, is that correct?
Correct, yeah. I'm doing a talk on CEREC guided implant surgery. So it's to do with merging the information that you get from a CT scan and also the information that you get from a CEREC scan, and just trying to use all that information so we can make placing implants as predictable as possible.
Okay, so that's for the placement as well as the kind of restorative aspect?
Absolutely. Well, you can use CEREC for both. Certainly a very, very good tool for restoring implants. But yes, the focus of my talk this time was on the surgery and the surgical placement.
Excellent, very good. Now, you qualified in Birmingham 2004, is that correct?
That's right, yes, yeah.
Good. And are you from that part of the world, or?
No, I'm actually from Slough, which is close to Heathrow Airport. Some of us try and pretend that it's in London, but it's not really. But yeah, I was really happy there, and I only really moved further afield initially because of uni. And then I've been happy in the Midlands ever since. So I stayed in the West Midlands probably for about 10 years, and I've been in Leicester now for the last 8 years.
And that's Oakdale, is that correct? That's
right, yeah. I took over at Oakdale about, it's coming up to 4 years now. Yeah, and it's been a bit of a whirlwind, but it's been brilliant.
And it looks like a great clinic. Is it 5 surgeries it has and the training facilities, yeah?
That's right, yeah. And it was always my vision to do something with education. I'm a bit of a geek, if I'm honest, ever since I was an undergrad. And I've been hungry for learning, and I thought it'd be a lovely thing to bring that learning to Oakdale and also to do a bit of teaching as well, which is lovely.
Excellent. And is that with dentinal tubules, is that correct, and ITI?
That's right, yeah. So we've got both those study clubs at the practice, and we also do some other talks as well, and we organise educational events for dentists in the area.
Excellent. How many delegates do you normally get? How many dentists would come to these?
We actually had a really lovely evening yesterday. We had Nilesh Palmer come and do a talk for the ITI, and I think we had about 15 or so for that one. So we tend to get relatively good numbers, and I think it's something that people give us good feedback for as well, which is the most important thing.
Excellent. Tell me a little bit about the book that you wrote as well. I was quite interested. It's a book for patients, is that correct?
Correct. It's a book for patients. So it's called The Smiling Dentist. The idea was, I know it seems a bit weird, but the title came from the fact that I was always happiest when I felt that a patient was happy. And they seemed to be happiest when they were well informed about what was going on and seemed to understand what was going on in their mouth and what they needed to do to get the best results. So I thought if I could write a book to help people who don't really know that much about their teeth and about their mouths, then I thought that might be something that's worthwhile. Also, I was born here, but my parents were born in Tanzania. And dental care there is terrible, and there's a wonderful organisation called Bridge to Aid which help to send dentists out there to improve the lives of people. So all of the proceeds of the book are donated to that charity.
That's excellent, and what a great cause. That's very good. So day to day you're doing kind of digital dentistry, and it's the guided surgery. Is that something you're doing on a daily basis then? Or?
Yeah. So we use the CEREC virtually every day. If I'm brutally honest with you, I think the majority of the patients I see, because I'm a general practitioner, so it's mainly for crowns and restorations and the like. But certainly we go through fits and starts, and I've been planning cases pretty much every day for implants. And I must say, implant dentistry is something I've become really interested in, and is, I think, naturally going to be the way that I gravitate towards.
So you're doing a lot of kind of restorative then as well with it, and as I take it, there's other dentists in the practice that will be using the system?
Absolutely, yeah. So all of the dentists in the practice use CEREC, and we're finding it's working really well. Because all the dentists have different needs. So one in particular, I have a really good associate called Josh, and he is doing lots and lots of ortho with Invisalign. So we're using the CEREC to take the scans for that. So it's a brilliant CEREC's a great piece of kit if it's utilised properly.
Absolutely. I mean, I first started using it about 10 years ago myself, and obviously my interest is in phobic and anxious patients, and it's what a wonderful thing for anxious patients to be able to get a predictable restoration in the same visit, you know.
Absolutely. I think you're absolutely right. The amount of times where you're thinking, oh, you know, now I don't have to numb this patient a second time. I don't have to drill this patient a second time. Yeah, they love it. And they love the fact that it doesn't need impressions as well. I think that's a big...
Well, absolutely. And again, for the anxious patient, that's huge. So especially if it's a sedation case, it's a single sedation, single load of injections, and all done in the same visit.
No, quite. It's a game changer.
Okay, so you rejoin us now. We've come down into the main lecture theatre as we wander around and explore the symposium. So, on that topic, the keynote speaker this morning, Bertlam Mesko, I think his name is pronounced. I really loved that talk. Healthcare needs a trip to Mars. What did you make of it?
Brilliant. The medical futurist, as he's also known as, unbelievably good. It's just not about dentistry, but so much about dentistry at the same time, which, that sounds really cryptic, but I think dentistry is more than just drilling and filling. It's about looking after people. It's about looking after our patients. And his talk was all about how we are, in some ways, letting our patients down, not through intention, but just because the world has changed so much. And it's up to us to try and keep up with change and leverage it the best way we can so that we can deliver what our patients really want. So I think their expectations have grown.
Absolutely, and I guess the whole digital dentistry thing being about the clinician and the patient working together as a team to produce something that's predictable and
Yeah, I fully agree. I think if we can empower our patients so that they can share the vision that we have for them with the treatment we want to deliver. Because if they can see that vision and agree with it and come on board, then they will love it, and they won't shoot you down afterwards because there's a misalignment in those two visions. Because they'll obviously have an idea about what they want to achieve, and it's about making sure that everyone's on the same page.
I think so, and in my experience as well, working within digital dentistry, the engagement you get with the patient when they see part of the process is just phenomenal.
Oh, definitely. I mean, I think the biggest change has been in diagnosis, really, and being able to take really good photos, manipulate those well, and merge the blueprint of what they're going to be like. But then also to be able to convey that to them as well, so they can see it in a way that isn't just like a model with a wax up on it. Because I don't think many patients understand really what that means. But when you're able to maybe put that into their mouth, so they get a preview of it beforehand, then they can smile and say, yeah, I like it. Or no, I don't. Let's not make the finals like that.
If you were speaking to a dentist who, I guess, hasn't started the digital journey and it's something that they're contemplating, obviously there's a big investment to begin with. What's kind of your experience with regards to the kind of initial outlay, return on investment, and that kind of aspect of it? What would you, somebody starting up, what would you say to them?
No, I think it's a really great question. One of the things that used to work really well was ready, aim, fire. Okay, so you'd get yourself ready, you'd do loads and loads of research, and then you'd make your decision, and then you'd go for it. But I think now the world has changed a little bit, and you've almost got a ready, fire, aim. So you've got to decide that this is for you first. That's obvious. But then I think you've got to just go for it. You've got to go for it, work out which system is going to meet your needs best. And that's probably more about knowing yourself than it is about knowing the systems. And then, once you have made the outlay, then you'll learn on the job. Because you'll be forced to. You've made that investment now. So I think that's it's a principle that I've tried to live by. And it's allowed me to achieve a lot quite quickly. But once you do start, I think it's a brilliant step. It's a wonderful way forward.
I think you're absolutely right, and I've heard cynics in the past talking of digital dentistry systems, and one of the criticisms they have is when you've got paid the money for the bit of kit, you're going to be producing more of it because you want to pay for the machine. Almost a suggestion that you're going to be upgrading what may have been a standard restoration into an inlay and onlay. I don't know how you feel, but in my experience that 100% is not the case. You have your clinical values and you have your treatment plan, and that's precedent.
Yeah, I fully agree with you. I don't think it's some cynical, nasty way of manipulating patients into doing things. But sometimes, if you know that there's a really predictable way of providing a restoration and the patient's going to be over the moon with it and you're going to have done a really good job that's going to last a long time as well, then you will subscribe to providing that way of dentistry. So I don't think it's a negative thing, and I think it's a positive thing.
I agree. You sell it not because of the financial aspect of it, but you sell it because it's something you believe in.
Absolutely right. You know that it would be what you would do for yourself. You know it'd be what you would do for your nearest and dearest if they came in. So that's what your patients deserve, that level of dentistry.
I agree 100%. Yeah. I guess getting back to the talk this morning with the futuristic...
With the medical futurist.
Medical futurist, that's right. And I remember from your interview with us through the Keyhole, you talked about being a huge Star Wars fan and liking your Marvel things. And I was thinking about that this morning while I was listening to his talk, thinking you must be really enjoying
Definitely, yeah.
his taking things. What do you have? Did it get your brain working over things during that lecture? Was there things that you thought of from films that you've enjoyed that suddenly came to mind thinking about medicine or dentistry?
Well, definitely this concept of actually we live in the future, because there are so many things that even in my lifetime. So I used to like a program called Quantum Leap. I don't know if you remember it. Sam Beckett, yeah. And his mate would come through. He was played by Dean Stockwell. What was his name?
Al.
Al. Well remembered, Al. And he'd come in with that little Ziggy, and he'd say, what the probability that this would happen? And we all do that now. We get into our phone and we pick up our phone and we can ask any question we want and we get the answer. It's an unimaginable thing for people who live maybe only even 10 or 15 years ago. And I think that is something that we should be able to leverage as well. But I think it's about asking the right questions, and it's about knowing and appraising the source of information we get. I mean, once upon a time, when I was at school, we used to learn how to research. You probably did that. Go to the library, the Dewey system and all that. That's not the problem anymore. It's appraising the research and knowing that what you're being fed isn't crap. And I think that, above all things in medical, dental, healthcare, is something that if we as professionals can get on board with, that will change the game and allow us to be informed and empowered to help our patients in the best way possible. So I think empowering our patients as well and allowing them to, have a look at Dr. Google, because he's not all bad, but just trying to steer their ability to appraise what they hear so that they're filtering it through common sense first, I think is a good thing.
Well, that's right, and it was myself that asked that question actually this morning, saying, patients are coming with information. We've got to up our game to be able to stay in touch with the things they're reading, but also be able to help guide them through. That's maybe not entirely true what you've read, and this is our take on it from the profession's point of view.
It's absolutely possible that I stole that idea from you this morning. So thank you very much for that.
No, it's fine. But I think it's something we all experience, because our patients come armed with stuff that they've read online all the time.
Absolutely. And I think it's important for us to not become defensive, not to feel that we're being challenged, because it's important to them. Of course they would research it. It's a natural thing. We would do the same. So we need to just learn to do that dance so that we can align ourselves with them, because I think that will allow us to build rapport even better. And let's face it, none of us are able to do dentistry very well on patients we don't like, and certainly on patients that don't like us. So it makes sense for us to be able to try and find ways to align with our patients and help them to help us, and likewise.
I think that's true, and I think there is a risk of, if a patient has a belief or something, a piece of information that found, for us to say, no, that's categorically not true, is sometimes not the right approach. And I'll often go for more of the I'm unaware of any link with this. That's something I'll look at myself to see if there is something that I believe there might be in it. But as far as I'm aware, there isn't an issue here or whatever. Rather than this, no, that's incorrect, because I think you risk then, as you see, losing that rapport, and the patient thinks this guy is not interested or is so closed-minded, I don't think I can work with him. Or, worse still, you're open up for complaints or problems because there is no rapport at that point.
Absolutely. I think to have somebody shoot your beliefs down, you think about how you would feel if somebody just said no to something that you'd hold dear. You wouldn't like it. And I think you're probably looking for a way to find some redress if that happens.
But what a changed world it is, though, because 20, 30 years ago, the dentist or the medic's word was absolute, and the patient wouldn't. Not only would they not have thought to question it, they wouldn't really have had the ability to.
Yeah, agreed. For better and for worse. I mean, there are some things that make it a difficult time for us to practice now. I can't argue with that at all. But there's a lot of opportunity in being able to have a conversation with people. I think it's a nice thing.
So what do you think the future holds in store for us then? Do you think we'll still be placing implants in 50 years' time? What do you think we'll be doing?
I think that is a superb question. In my own practice, I'm finding that I'm trying to upskill the people around me as much as I can, so that, well, it means that I'm able to do more of what I want to do. And I think that if we can be upskilling people, but also using technology as well, it will allow us to do more of what we want to. And I think that's probably the future I want to gravitate towards. I understand as well that the iPhone can be a wonderful tool, but it can also trap you as well, because if you feel that you have to keep checking your emails, have to keep checking Facebook, then it can become a double-edged sword. So I think it's up to us to try and take control and use it in the best way possible.
Absolutely agree. Yes, I do. Okay, I'm trying to think if there's any other questions. It's been fascinating to sit and talk with you in person, having read obviously your article in DentaltownUK, and great to actually meet you in person. If you have any cases or anything that you'd be interested in publishing with us, it'd be awesome to have that in the magazine. And I sincerely hope you enjoy the rest of the conference and your time here in London. So thank you very much.
And thank you so much for interviewing as well. It was a lovely opportunity.
A real pleasure. Thank you.